from the Health Minister about a new advertising campaign that's going to be rolled out I guess before the vaccine is rolled out. What do you hope to achieve with that advertising campaign?
Well, the most crucial component of any vaccine rollout, not just for COVID-19, and remember we've done this many times before, we use a lot of immunisations in Australia, and Australians are rightly confident of the immunisation procedures that we do before immunisations are used, and the ability and understanding how important immunisation is, particularly for our children. So that's something that we're very used to, and Australia has a very high immunisation rates right throughout the community. The crucial component of that is confidence in the system. So we need to build confidence in this particular vaccine. Of course, there's been a lot of interest and discussion about it. The approvals and so forth have gone fast, much faster than usual, for a reason, because of that danger that we're in and trying to get back to some sort of normal life. But absolutely, and I'll say this again, as we've said many times, there are no shortcuts. Every tick that needs to be ticked will be ticked before there is any rollout of this vaccine into the community. So a lot of the campaign will be about that, making sure people are confident. People are also understanding some of the practicalities, who's first in the queue and why. And where those queues might form. So where can you get your vaccine if I'm in this particular group? Where do I go? So those sort of practical things. But confidence is the key first.
And we've seen sort of, I guess, maybe a shift slightly in targeting sort of more tailored messages to groups, whether that be migrants or whether that be different subsects of the community. Why is that approach being taken?
Well, it's very important that everyone gets the message in an appropriate language, in their own language, and not only in their own language but in appropriate words. And we know that there are some parts of the community who are more hesitant about vaccines. We need to definitely address them directly, and that's really important. Look, in the end, we want as many people as possible to have this vaccine, starting with those priority groups, but then moving into the general population. And so the more people that can be vaccinated, the better.